We're going to bring in our medical correspondent, Dr. John Torres. Dr. John, that was a very disturbing and upsetting report. African Americans are being hit disproportionately hard. We broke down some of the reasons why. Medically, why do you think that is?
So, Hoda, you're exactly right. It is very disturbing to hear these, and it's people of color generally are more susceptible to diseases, and we know that they have those pre-existing conditions, the diabetes, the heart disease, the asthma, that makes them more likely to suffer consequences because of coronavirus. And part of the reason they have that is there is a genetic component behind that, because we know that some of these things like high blood pressure in African Americans tends to be worse. But also at the same time, we know that there's some socioeconomic conditions that are causing them to be in situations where they're not only more likely to get coronavirus, but also more likely to suffer the consequences behind it. Healthcare access is limited in some situations, in a lot of situations across the country. And to be honestly frank, there are some situations where they're distrustful of the medical community because of history that's happened in the past, and so they're more reluctant to seek medical care until they absolutely need it, and that means they're not getting that early care that can have a huge impact.
I would imagine it's easy to track race in a hospital, but not as easy to track poverty. Do you think the most vulnerable are the poorest, regardless of race?
I think exactly that. The most vulnerable are going to be the poorest for a couple reasons. One, they have those food deserts we talk about, and they don't have the education that other people have been given, saying, here's what you need to do to stay healthy. Here's the things that can help you out. Plus, they tend to live in situations. If you think about it, a lot of people of color tend to live in areas where they're in multi-generational families in the same house, so they're crowded together. The conditions aren't quite as open as other areas where they can get that social distancing, and so that is a huge factor in getting them more of coronavirus on top of it, but the consequences behind it. And like Blaine said, they tend to have those jobs that put them out in the forefront of having to contact other people, having to go to work, and being more likely to get coronavirus and the consequences of it.
Dr. John, let me just ask you one final thing. It was on the front page of every single newspaper. It was the folks in Wisconsin. I don't know if you can see them. I know we only have one cameraman, but anyway, they're voting, and they're in lines, and they're stacked up. I was just curious what medically you think the risk is of that exercise yesterday.
And, Hoda, from a medical perspective, that's definitely a head scratcher, because even Dr. Birx earlier this week was saying, give us a week, give us 2 weeks, everybody stay inside, don't go to the grocery stores, don't go to the pharmacies. Yet we have these people waiting in line. If you see the pictures, some people are doing that 6-foot distancing, some aren't. Some wear masks, some aren't wearing masks. But every time you go outside, you are risking getting exposed to coronavirus, and that's just another risk, especially standing around for hours waiting to vote. So, again, that's a bit of a head scratcher. I understand the political issues behind that, but at the same time, we're in a medical situation right now. This is a medical emergency. We need to think of that first and foremost.
All right, Dr. Torres, thank you so much.
零视频 APP 等你下载。